Hi everyone, and welcome back to my channel. Welcome back to the series 5 in 5, where I provide you with 5 clinical tips in 5 minutes or thereabouts. As always, if you haven't subscribed, then why not consider subscribing, because I have loads of useful videos to support you on your medical career journey. And as always, hit that like button if you enjoyed the video and gained value from it. So let's get started. Today's video is going to be about taking a social history and why that's also really important. So my first tip is about smoking and alcohol. Often I find a lot of medical students feel that asking about smoking and alcohol is enough to ask about, and that is the social history. A social history is so much more than asking about smoking and alcohol. This is your time to really get to know your patient, to really understand their social circumstances and how that affects and impacts their health. Use this time to find out about their work. What do they do for a living? What is their occupation? And could this be impacting their health? Could they have an illness related to their occupation? Ask about their financial situation, especially now during the pandemic when people may have lost their jobs or may not be getting the pay that they should be getting because of reduced customers or clientele. Are they getting any benefits to support them? Are they getting any support from their employer? And if not, how can you help them? Is there support that they are entitled to but they're just not aware of? Tip number 2 is always ask about their living circumstances, their living arrangements. Who exactly do they live with? Do they live alone? Do they like living alone, or is that difficult for them? And I would say here, never assume, always specifically ask. Tip number 3, where exactly do they live? Now, don't just think about, is it a house, is it a flat? These are the standard questions that I often hear medical students asking, and I used to ask, and I still do, and it is important. But it's also important you think a bit outside the box. So think about their wider environment. What is their borough or area like? Is it an affluent area or is it a deprived one? And how does this impact them and their health? So of course, yes, what is their home situation like? Do they live in a house? Do they live in a flat? Are there stairs to get into their apartment? Does this affect them? Do they have access to an outside area like a garden? Is it a communal garden? Is it their own private garden? Especially now in the lockdown, people may not have access to a garden. They may be in a flat, they may be high up, and they might be on the 20th floor or higher. This may affect mental health. It may affect their physical health. Tip 4 is, how do they manage their ADLs or activities of daily living? Are they having difficulties with this because of their presenting complaints or because of something else? Examples of ADLs are things like washing, dressing, cooking, shopping, and so on and so forth. Do they have carers? And again, if you ask about carers, make sure you get specifics. This is something that I often have to encourage my medical students to ask about. When you ask a question, ask a follow-up question and get specific information. So if you say, do you have carers? How many carers do you have? What do they help you with? How often do they come? Do they come in the morning? Do they come in the evening? Do they come 3 times a day? So really get specifics about what you're asking. It might be worthwhile asking, how do they find their carers? Are they happy with their carers? And if they're not, is there anything that you can do to assist them? It might be a good point to ask about any adaptations to the house that they already have or that they may need. Do you need to get an OT maybe to assess them? Tip 5, of course, ask about smoking and alcohol. It's important to quantify. It's important to get the amount of cigarettes or whatever else that they may be smoking. Again, at this point, it's good to ask about recreational drug use. Never assume. Always try and ask about recreational drugs, of course, if it's relevant to the history, but generally you should be asking about smoking, alcohol, and recreational drug use. So never assume and be wary of stereotypes. And if you're not sure about a particular drug, then again, just ask them. Like I said earlier with follow-up questions, if someone says, I don't smoke, it's good to ask, have you ever smoked? Because if they have smoked in the past, do they have a significant pack year history? Have they smoked for 30 years, 10 a day? That would be really important if they've come to you maybe with a cough. So always ask follow-up questions. The very last thing is to consider social prescribing. If you don't know what social prescribing is, then make sure you find out. There's only so much I can tell you in 5 minutes or thereabouts. Most surgeries will have a dedicated person that they can speak to about social prescribing, or at least be able to refer a patient to the social prescribing team. Social prescribing encompasses loads of different things. They may signpost patients to places of financial support and assistance. So those were the tips for a good social history. I'm just scratching the surface, but I felt that this would be more than enough to get you started, or at least get you thinking. As always, if you enjoyed the video, then make sure you give it a thumbs up and subscribe if you haven't. I will see you in the next video.